Hey everyone. Look, almost all of us have dealt with some kind of gut trouble, right? But trying to figure out what's actually going on can be super confusing. So today, we're going to break down some of the most common bowel disorders and hopefully bring some real clarity to it all.
You know that feeling. Is this just something you ate? Is it the stress from a crazy week at work? Or is your body trying to tell you that something more serious is happening? It's that nagging uncertainty that we're going to tackle right now.
Okay, so right off the bat, this is the most important thing to get. On one hand, you've got an irritable system. It's sensitive, it's causing discomfort. But on the other hand, you have an inflamed system, where there's actual physical damage happening. These are two totally different roads, and knowing the difference is everything.
So let's dive into that first path, the sensitive gut. We are now entering the world of irritable bowel syndrome, or what most people just call IBS.
The word you really got to latch on to here is non-inflammatory. With IBS, you can be in a lot of pain, you can have cramping, but if a doctor were to look inside your bowel, they wouldn't see any physical damage. No ulcers, no lesions. It's a problem with how the gut works, not what it looks like.
And honestly, this is the perfect way to think about it. The gut's communication system in IBS is like a car alarm that's just way too sensitive. You know, the kind that goes off if a leaf lands on the hood. The system is definitely overreacting and causing real problems, but the car itself, your gut, is structurally totally fine.
So what's setting off this super sensitive alarm? Well, the truth is, we're still not 100% sure, but we know it's a really complex mix of things. It could be environmental, like how you react to dairy or caffeine. It could be certain immune signals, and there's a huge connection to stress, anxiety, and depression. That mind-gut connection, it is absolutely real. But here's the good news. You're not helpless. IBS can be managed. The whole approach really puts you in the driver's seat. Step 1. You have to become a detective. Start a food and bowel diary to figure out your personal triggers. Step 2. You got to tackle stress head-on. And Step 3. Make some smart tweaks to your diet, like maybe cutting back on irritants and upping your fiber and water.
Okay, let's switch gears and go down that second path. We're moving away from a gut that's just sensitive to one that is actively inflamed. We're talking about inflammatory bowel disease, or IBD.
And you can see the difference right away. IBD isn't one thing. It's a category that includes chronic diseases like Crohn's and ulcerative colitis. And the key word here is inflammatory. This is a whole different ballgame. It's an autoimmune response where the body is literally attacking and damaging its own GI tract. So, if IBS was the glitchy car alarm, IBD is like finding rust eating away at the actual frame of the car. This isn't just about a sensitive system anymore. This is a structural problem. We're talking about real, physical damage that has to be addressed with medical care to control that inflammation and stop it from getting worse. And because we're talking about actual damage, the way it's managed is way more intensive. The number one goal is to calm down that inflammation. Sometimes that means resting the bowel completely, like no food or drink at all. It also means very specific medical diets, especially during flare-ups. And it requires really close monitoring, because that chronic inflammation, unfortunately, can increase the risk of colon cancer down the line. Now, whether it's because of IBD or something else entirely, sometimes things can, well, get blocked. So let's talk about what happens when your gut literally hits a roadblock. We're talking about an intestinal obstruction.
These obstructions basically come in two flavors. First, you've got a mechanical one. This is a physical barrier, like a landslide blocking a highway. It could be a tumor or maybe scar tissue from an old surgery. Then you've got a non-mechanical obstruction. In this case, the road is clear, but all the traffic is just stopped. The bowel itself stops moving, a condition that can often happen after a major surgery.
One of the scariest kinds of mechanical roadblocks is something called a volvulus. I want you to picture the intestine literally twisting on itself like a knot in a garden hose. It completely chokes off its own blood supply, and as you can imagine, that becomes a critical emergency, fast. Another type is called intussusception. The best way to visualize this one is to think about a collapsing telescope, where one section of the intestine just slides into the part next to it. It's so important to get this. Both the twist and the telescope, they are major medical emergencies that need immediate attention. Okay, so with all that in mind, what are the absolute, you cannot ignore red flags? This is the kind of stuff that could literally save a life. One of the most dangerous complications out there is something called peritonitis.
This is a life-threatening inflammation of the peritoneum, which is the super thin membrane that lines your entire abdominal cavity. It happens when something ruptures or tears, and bacteria spills out into what should be a completely sterile space. So, you have to know the signs. This is an emergency. If you ever see someone with a stomach that is rigid, hard as a board, plus a high fever, terrible pain, and vomiting, that is a massive red flag. These are the classic signs of peritonitis, and it's time to get medical help immediately. Now, just to bring it all home and understand how serious these conditions can get, let's go back to IBD for a second. In the most severe cases, a surgery called an ileostomy might be needed. That number you see, 1,000 milliliters, that's how much fluid, a full liter, can drain from that ostomy every single day. It just highlights the unbelievable ongoing risk of dehydration and electrolyte imbalances that patients have to manage. It's a constant, careful balancing act.
So it really all comes down to this, doesn't it? From the subtle whispers of IBS to the loud, blaring alarms of an obstruction, your gut is communicating with you all the time. The real key is learning its language, understanding what the signals mean, and knowing when it's time to really listen.